Hi, and welcome to this week's mini mental health training. Today we're going to just focus on emotional distress. I'll go over how to identify those that may be experiencing an emotional crisis, how to recognize signs and indicators of an emotional crisis, and develop awareness of the four factors that could be contributing to the emotional crisis. There are four different factors that could be contributing to someone in emotional crisis or emotional distress: substance abuse, mental illness, situational stress, or medical issues. Someone in emotional distress could be experiencing one or multiple of these factors at the same time. It is always good to take a step back and ask yourself what is contributing to this situation. The first factor is substance use. So, substance abuse is when the drug impairs function in physical health, emotions, perceptions, and/or relationships. Substance use could also result in excited delirium, which we'll get more in depth in a different presentation. But excited delirium is a state of extreme mental and physiological excitement characterized by extreme agitation, hyperthermia, hostility, exceptional strength, and endurance without fatigue. The second factor is situational stress. This is caused by a person's reaction to a life event, so it's perceived as overwhelming. Their usual coping skills are ineffective, so now they're in an emotional crisis or situation. It can result in unusual behavior or suicidal threats. One example of this is post-traumatic stress disorder. Someone's experiencing bad memories or flashbacks. It could contribute to their emotional distress, and that's an example of situational stress. Medical conditions is the third factor. It can occur from aging, injury, or disease. It can impair one's ability to respond to what's going on. It can result in very challenging dispositions. Examples of this are head trauma, dementia, Alzheimer's, medication reaction, diabetes, and also in older people, untreated UTIs can be perceived or can have psychotic symptoms go along with it. And the last factor of emotional distress is mental illness. So mental illness is a problem with feeling, thinking, and or perception that can impact the ability to relate to others and or function on a daily basis. Each person with a mental illness has different experiences, even those with the same diagnosis. So two people that have schizophrenia can have very different experiences and very different symptoms that go along with their diagnosis. Not every person with the same diagnosis is the same. So, how do you know that someone is in emotional distress? You look for the environmental indicators, verbal, and behavioral indicators. Looking around the environment can give you an idea if someone is in emotional distress. So, what does the environment look like? Are there windows or walls covered in tinfoil or feces? Are all the electronics pulled out of the walls? Is there any strange noises in the house? Smell can also indicate that something may not be right. Does it smell like somebody has been, defecating on the floor, that garbage has been piling up? Also, pay attention to the temperature. Is it too hot or too cold, especially in this area? We get very, very hot days and very, very cold days. Is the temperature in the person's house appropriate for the weather? Also, be mindful of cultural factors that could contribute to the location. An example of factors based on location is this house. So if you saw this house in Buffalo, it would probably send up some red flags because of all the windows covered in tinfoil. However, in Arizona, it may not look as weird because people do this to their windows to help keep the house cooler. So location, cultural factors are going to play into the environment. Behavioral indicators may be one of the easiest to recognize because it's usually someone's behavior that leads to the 911 call. Observe someone's appearance. Are they dressed appropriately for the environment? Again, we have very cold winters. Is somebody walking around without shoes on and short sleeves in the middle of the winter? Is someone wearing a winter coat in the middle of the summer? Those could be red flags that something may be going on. Also, pay attention to somebody's body movements. Someone in emotional distress could have unusual posture or mannerisms, repetitive or ritualistic movements, also may appear lethargic or agitated. So pay attention to how they're moving their body and does it match the situation that's going on. Finally, pay attention to what someone is saying and how they are saying it. So, how is the individual expressing themselves? Listen for illogical thoughts, unusual speech pattern, hostility or excitement, or speed in which they are speaking. A lot of times, people in a manic state speak very, very, very fast. And that can be an indicator that there is mental health going on. So, not only do you listen to what the person is saying, but how they are saying it. Thank you very much for listening. And this is my contact information if you need anything. And look forward to talking to you again next week.